Well, welcome everyone to the Employers Healthcare Alliance Summer School Series. This is the second of two series, and we want to thank you for joining today as we talk about Check My Spot, skin cancer awareness. Hey, it's a beautiful, sunny summer day. Sometimes when we go outside, we don't always think about sunscreen or protecting ourselves, but we probably should, right? Even when it's beautiful and sunny out. But we also need to protect ourselves almost anytime you go outside, right? So let's talk a little bit about the webinar. Today we will be recording the webinar and we'll post it in vignettes on LinkedIn, those little small clips, and we'll also have it posted on YouTube. If you're interested in receiving the recording, give us a couple days and reach out to me, and I'll leave my contact information at the end of the webinar, and I'll be happy to send you that recording. So today we're talking about skin cancer awareness. Over the next 30 to 40 minutes, we'll explore how Check My Spot is actually going to show us how this is really, really easy. And for those of you in HR and benefits, gosh, this is so easy. You barely have to do anything except to answer questions. And Check My Spot, the folks at Check My Spot are just tremendous, and they're going to help walk you through. But it's also going to talk about skin cancer prevention, some things that we may know and some things that we just don't know that will be really helpful to help both ourselves and employees. And we'll learn a little bit about member engagement, measurable outcomes, and specifics to HR and benefits professionals. We do encourage you to raise your hand and interact with your questions. It'll be an interactive webinar, so we will leave time at the end of the webinar as well for all of your questions. If we don't get to your questions, I know there's quite a few people signed up, please email us and we will get the answer to you. So let's get started with introducing Check My Spot.
Thank you, Kay. I'm Elizabeth Webb, and I'm CEO of CheckMySpot, and I want everybody to meet my husband, my co-founder, skin cancer expert, and chief medical officer of CheckMySpot, Dr. Mike Webb.
Yeah, hey.
And
So I'm going to kick our slides up here, and we'll
get started.
Start this. And
Kay, one of the questions we often get is, how did y'all think of this? Like, what prompted you guys to create this? And Mike and I have noticed over the last 30 years a simple observation. People always notice serious skin lesions or suspicious skin lesions way before they ever seek help from a professional. So it's not an awareness problem, it's an access problem. And so we notice this in our community, we notice this in his practice. People are always coming up to us going, "Hey, what's this? I can't get an appointment. Can you help me?" So we sat down and we came up with Check My Spot. And employers, they're in the same
Elizabeth,
boat.
what is the time frame to get an appointment these days? I know what mine was. So what is the time frame if I like to see a dermatologist, if I have a suspicious spot or want to get something checked out?
The average wait time is about 36 days, but that can be even longer in areas where there just aren't as many specialists, like rural areas or,
Sure.
Areas that they just, dermatologists don't want to live there. So they're, you have to travel 100 miles to get to one. So it's several months.
I'm in Florida and it took me 3 months, right?
Right.
Yeah, that's probably about average, Kay. And the more advanced the practice is, the more established, I should say, is usually the longer wait.
Mm-hmm.
And then in dermatology deserts, you have to factor in travel times and what it takes to get a person there. But the waits average anywhere from 6 weeks to 6 months, depending on the practice itself.
And for employers, there are employees in every employer's population who are facing this same problem. They're like, "Oh, I've noticed this new spot, but I can't get a dermatology appointment. It's taken too long. I'm not really sure what to do. Should I take a day off work? What if it's nothing?" And these delays are the reason Check My Spot was built. We want to close that gap.
Yeah, and I'm going to kick this slide up and just sort of explain it briefly first. If you imagine the left side of the slide is when a spot appears, it's first discovered by a person at 6 months, and then they delay and they go through this process deciding if this spot is or if it's something that should be evaluated. and that's valuable time lost. That's usually 6 to 12 months. And as they wait, outcomes plummet and costs rise. So, and as a physician, I've seen that delay repeatedly because they'll discover it and then they'll wait months before they seek care. So the opportunity really is to connect people with an expert opinion much earlier in the process. And you'll hear us talk about, as this slide illustrates, something called the point of discovery. And that's once someone identifies a changing lesion or a spot, we're no longer talking about random screening. This is something that they're concerned about and is suspicious to them. They're worried about it, and it could be something much more significant. It shifts them into a higher risk category. So, since we're evaluating something that's already raised that concern, there's a much higher probability of finding something clinically meaningful. And as this slide demonstrates, that's when the clock starts ticking for worsening outcomes and claims that are going to be unnecessarily elevated.
But
And
with the check my
let's be
spot
honest.
benefit.
Let's
Oh,
be
go ahead.
honest. As an HR benefits professional,
Mhm.
how many times, and for me even too, being in healthcare, people will approach you and go, "Hey, do you think this is skin cancer?" We are not dermatologists or oncologists, right? It's like, I don't know. Well, now you can say, you know what? I don't know, but let's take a picture of it, right?
Exactly. That's exactly how we came up with the idea
Yeah.
because I'm married to a dermatologist, people think I'm a dermatologist, which is, you know,
And
God help them.
she's so nice that they say, "What do you think this is?" Well, I immediately get the picture, and I'm in the middle of a workday. And I said, "We've got to regulate this to make it appropriate and
Right.
best care for everybody." She came up with the idea, but that really, what you just mentioned, it was our founding story, how we came up with this idea.
And Daryl has a question. So, Daryl, let's take your question right away.
Yeah, so you said that the outcomes get worse and the cost goes up, but can you kind of define that? What is, I mean, if month 6, if you catch it at like a stage 1 as opposed to month 14, what are you talking about as far as cost?
That's a great question, Daryl. Really, what you're asking is, what does this mean? So, stage zero or a stage zero melanoma, where it's confined to the upper and outermost portions of the skin, 99% survival rate. When caught early, less than $1,000 to cure. When
Wow.
it gets to stage one, just slightly thicker, that's usually about month 8 to 12. It gets to stage one, you're looking at a 95% 5 year survivability, cost still less than $1,000 to cure, all done in the clinic. Then that cost curve begins to go up parabolically. And between stages 1 and 2, you see increased expense for surgical complexity, getting upwards between $5,000 and $15,000 for a total spend. And where it really jumps is late stage 2, which is about month 18 that a cancer has been there. And you're getting into becoming a specialty pharmacy event with Keytruda, and that's only getting worse. And that's where the rocket blasts off on total health spend, and you put your catastrophic claims and your stop loss coverage at risk. Specialty pharmacy, and I don't want to get too into the weeds, but we're talking about Keytruda, Opdivo. Those indications are now earlier in stage 2 melanoma, and they are about $100,000 a year. When you get into that spend, they're increasing uh, survival times, but half the people fail that PD-1 therapy. So, depending on how many years you've been on that, the next FDA approved step is something called TIL therapy, and that's a $600,000 treatment. All of this to say, if you're looking at this slide and you see that point of discovery, we want you in as quickly as you discover it so you can avoid those worse outcomes. And those are only the direct costs I mentioned. We haven't even talked about indirect loss of productivity and time away and disability that come also as it moves further to the right. As you can see, this poor fella and his family on the slide, that's what happened to them.
Daryl, you had a follow-up question?
Yeah,
I
because
don't
I mean,
think I can.
costs are important and something to worry about. But I
Sorry,
mean, the
sorry, I was on
patient.
mute. So I
Oh,
think
that's
what you
okay. Go
guys are
ahead,
doing
Daryl.
is fantastic, right? And now I've never had one. I've got this great Iberian skin, right? So I've got real dark skin. So I've never had any of the problems, but my family does.
Yes.
I mean, if you see something at 6 months, is there any kind of symptoms that you feel other than this spot is getting bigger or worse? I mean, do they feel nauseous? Do they feel sick? I mean, is there any other symptoms that go along with this thing getting to seriousness?
No, that's another great question, Daryl. They're asymptomatic. People aren't aware and they just see the spot. And, we've had great public awareness campaigns, the American Academy of Dermatology, the Skin Cancer Foundation, ABCD, is a big program. If you don't and aren't aware of what spots look like, rather than me teach you today, let me refer you to both of those websites, the American Academy of Dermatology or the Skin Cancer Foundation, and you will learn. But to answer the question you asked, most early skin cancer and melanoma is asymptomatic. It starts off as a new bump or spot or something that is like a pimple that won't heal or bleed. And those are the things that grab people's attention. They are aware, most are aware that bad spots or spots can be bad, but then they don't know if they're bad because they don't know what they're looking at. Despite all of this public awareness attention, that's what we're hoping to address.
Mhm.
We want them to know, hey, I've got a board certified dermatologist literally in my back pocket. I just pop a couple of questions and I get it, I get their eyes on it. And it is an instant peace of mind, immediate peace of mind, or we can triage and elevate the care at the next portion of our value proposition, which is getting people in soon when something has been flagged.
So, as a transition here to the next slide, we know that this is not just a personal individual issue, it's a workforce health issue. And like I said, people show up in HR's office or they're talking with their colleagues and they're not really getting a result, right? Because those folks, as well intended as it is, aren't able to help them, except here's a dermatologist, you'll see him in 3 months. So with Check My Spot being visual, being virtual, and the ease of which it's implemented and accessed, can you talk a little bit more about the skin cancer prevention, maybe campaigns or promotions you can do once an employer has engaged with Check My Spot to help get that out there?
Well, yeah, you want to talk about the prevalence of skin cancer?
Well, yeah, let me mention that there are great awareness campaigns for prevention. Sunscreen, slip, slap, slop is one where you can find these on the American Academy of Dermatology. Wearing your sunscreen, avoiding midday sun, all of those primary prevention tactics are well defined and generally well known. But like I tell people with sunscreen, if you don't open the bottle, it's not going to work. So you have to integrate these in part of the daily strategy. And the reason that it's important, and particularly from an employer or benefit standpoint, is that it is so prevalent. It's the most common cancer in America. 1 in 5 people will face it. In 2 hours, I mean, 2 lives are lost every hour. And employees know someone who's been affected by either a deadly melanoma or they've had a disfiguring skin cancer. So they're worried about it. They just don't know what they're looking at. And I will point out that most spots that people flag are benign new spots, actually 4 out of 5. So they're not sure what their next action plan should be. And that's what we're hoping to provide.
Right.
So outdoor workers, they face an elevated exposure, and that risk not only is for outdoor employees, it's across all workforces because, like you mentioned, like Daryl mentioned earlier, that age and family history are big risk factors. How much time someone has spent over their lifetime is a big factor. If it does run in families, the genetics of skin cancer are important. And if they have a history of it, all of those contribute to a higher risk.
That's
let
right.
me
And
draw let me draw a line here because I just want to put things together. Most prevalent cancer in America, right?
Yeah.
Delays can escalate quite quickly.
Mhm.
When you get to a stage 3, stage 4, the survivor rate is tremendously lowered. And all you have to do is pull up your phone and take a picture to diagnose it early enough to avert all of that.
It is that simple. Yes, that's why after 30 years of treating avoidable advanced skin cancer, I am super excited. You'll see me start to bubble up in my seat
You
as we
really
talk
will.
about this more and more. We have seen more intervention earlier and made a greater impact, and I'm confident if this is widely deployed, there will be more cancer cured than I have done in 30 years of treating these advanced cancers.
And it's as simple as doing it in your own home.
Right. You can do it in your own home. You can do it on a break when you're at work. You can do it after a shift. You can do it over the weekend. You get your response in 24 hours, and you're not just left up in the ether. We actually follow up, stay engaged, and say, okay, this is something to worry about. These are the steps you take next. And we
So
make it
Daryl, you
happen
can
fast.
you can take that picture of your wife's spot and send it without her even knowing it.
That's right.
Well,
I like it.
you bring up a great point, Kay, because 2/3 of skin cancers are first noticed at home by a concerned family member.
Hmm.
Someone will step out of the shower, or they'll be dressing, or someone will be putting on their golf shoes, or they're stepping off the tennis. Hey, did you know you had that spot? No. Or yeah, I did. I'm watching it for, oh, don't do that. Cousin Joe had a bad spot. He watched it. And then they worry. And that's what we're looking to address and prevent another Cousin Joe bad outcome from happening, or to those people themselves.
I know Daryl was really excited about this webinar, so he has another question.
Oh, good. Thank you,
I
Daryl.
have
We
to tell
love
you,
questions.
Yeah.
I've been looking forward to this all week. Um, the color of your skin, like I have fairly dark Iberian. I'm an Iberian, right?
All
So
right.
I have fairly dark skin, and when I go out in the sun, I turn red and then brown. And
Mhm.
but if the does the color of your skin, I mean, does spots show up? I mean, if you had really dark skin, would it? How do you see these spots as opposed to somebody that's like my wife who's Scotch Irish and she's as white as a ghost, right?
Yep. So you bring up two good points. Um, Light-eyed and fair-skinned people are at higher risk, and it all has to do with how much of this cancer-causing ultraviolet light can penetrate into the skin.
Mhm.
So if you're genetically programmed to tan nicely and have a darker tan, if you have brown eyes in particular,
Like Daryl.
then you're offered some protection, but not complete protection, because we take off melanomas regularly in even the most darkly pigmented individuals.
Mhm.
So it will show up as a sore or a spot that simply won't heal, just sort of has a little crust or bleeds intermittently, just seems to persist for months. Or it will be a spot that is abnormal in some way, just different from the other spots. Either it's lighter, sometimes it's lighter. Sometimes melanoma is completely pink or completely flesh colored. So that's why the American Academy, I'm going to refer you back in ways to survey your skin. They recommend a monthly self skin exam, and go to their website. It'll show you how to do it. We have links on our website to it if you want to go through our website, but directly you can go to the American Academy of Dermatology or the Skin Cancer Foundation. Um, and then they recommend that you have a in-person complete, the American Academy of Dermatology does a complete skin exam in person once a year. And that's to sort of take that burden off of you, Daryl, so you don't have to worry. So we don't propose that, we're not looking to replace
Mm-mm.
an annual complete skin exam in person. We're looking to address those spots as they pop up on somebody, because when they notice them, they wait. And that's what we're trying to eliminate, is that wait. It's deadly. And even if it's a benign spot, it affects them adversely because they worry about it for months before they get the answer they're looking for.
So we touched on this a little bit, but what are you hearing from employees and employers on barriers to actually access or to identify skin cancer or to get treatment?
That's a really good question. The most common themes we hear are access to care, scheduling is an issue. We've talked about how long the wait times are. Geography is an issue. We talked about dermatology deserts or rural areas where there's not specialty care. And then there's uncertainty in the employees' minds, like, do I need to use my precious time off to have this evaluated, or should I just wait it out? So we're trying to keep the employees at work, but also keep them healthy because that's really our main goal.
Yeah, we want to keep them worry-free and healthy.
Mm-hmm.
And people aren't avoiding care. They're not just saying I'm not going.
Mm-hmm.
It's not because they don't care. It's they're waiting, as Liv mentioned, because getting access to specialty care where they can hear immediately that spot's okay. Don't worry about it. Just keep an eye on it. Or no, you need to come in right away. They don't have that, and that requires specialty care from derm because a lot of times they may hear from a friend or someone else, that's fine. You'll know if it's something bad. Well, you don't know it's bad until it's really bad. So, we're looking to address that gap. Again, I want to say it's like having your dermatologist in your back pocket. Just pull it out, pop off a few pictures, and then go either move forward worry free, or hey, I've got a plan and I'm going to get in as fast as I can for the best possible outcomes.
So we've covered quite a bit. Let me just pause here to see if there's any other folks that would like to ask any questions before we move on. We'll talk next about shifting to the employer perspective. I think that's slide number 4, and how employers can understand and solve the problem without taking a lot out of your workday too. It's great to say we have these programs and what they do, but then how do you get people to use it? And how much time is it going to take me to implement it?
Exactly, because employees are not going to use benefits if they're complicated. They're not going to take the time to do it. And employers want benefits that solve real operational problems because they've got problems and they want them solved. So we're trying to solve access problems. We want to make it convenient. We want to keep people at work and we keep them healthy. And ease of administration is a big deal. So CheckMySpot is designed to be extremely easy to explain, easy to implement, and easy to manage. So we're not just dropping a bunch of work on HR. We're giving them a meaningful skin benefit that is relevant and easy to manage. And from the employee's perspective, these people are busy. Convenience is key. So if they see something, like I said earlier, if they could submit that lesion after work or after hours or on the weekend when, their spouse says, oh, what is this? We got to get this checked out. They're going to use a benefit that gives them access to specialty care if it's accessible and easy to use and is there when they need it.
Yeah,
So
and I'll
let's
just add, yeah.
go ahead. No, go
I
ahead,
was
Mike.
just going to add that, again, our goal is not to replace, every office visit. We want to help employees get that appropriate level of care more efficiently because, we alluded before, 3 out of 4 spots are okay when they worry about them. And they're immediately reassured with Check My Spot, and they can avoid an unnecessary visit, stay productive for themselves and their families, and also their employers. And if it's the other case, that 1 in 4, they can be directed more quickly to in-person derm visits where they can get a biopsy or they can get rapid treatment, which takes the most important factor for survival, and that is reducing that time to definitive treatment. That's the key. You'll hear me reference that a lot. It's called TTDT, time to definitive treatment. And it's one of the key aspects of keeping employees healthy.
What was the other one you said? Slick and slide or something?
Slip, slap, and slop.
Yeah, slop. Slop.
That's
Yeah,
memorable.
that's a campaign by the Academy. It's pretty cute.
It kind
That's
of
cute.
sounds like me in the kitchen, but I mean,
I was going to say, that could apply to many things. So for those of you in our audience, if you'd like to ask a question, just raise your hand and we can unmute. Otherwise, we'll keep moving along. This is some great information, guys. We love just how easy it is. Take out your phone, take a picture. You guys are so easy to work with.
Well, I was
Let's
going to add in that this is especially relevant for like workforces that are dispersed across the country. They're not all in one place, or they're driving a truck all the time and they can't, their schedules are not traditional 9 to 5 schedules. So Check My Spot really can close access gaps like that in a lot of situations.
Yeah.
So think about this also as an on-site clinic, okay? Employers that are engaging in on-site clinics, that clinician has X amount of minutes to see the person if they're not feeling well, or
Mhm.
an annual physical is usually a good time, or doing a skin cancer screening. But there's a lot that goes on in an on-site clinic. And now if you have somebody coming in that you're going to need to do, even a biopsy or anything like that, but to get that relief immediately, that clinician could call or contact Check My Spot and have that photo downloaded right away, and the interaction right there too, right?
Yeah, so we have a major manufacturing client who has been one of the earliest adopters and advocates for employee wellness, and they offer an on-site clinic. And we have worked with them to get their what I call the tap out, the 2-minute tap out,
Mhm.
meaning when an employee comes in and says, "Hey, what do you think about this spot?" And Kay, you're right. My primary care colleagues have so many hats to wear and so many problems that come through, and the majority of them are critical that need proper maintenance and fine tuning. That the time to address a spot quickly for someone is just a difficult task for them. So with our on-site clinics, what we offered in this particular client we work with in the manufacturing sector, they love our 2-minute tap out. Someone brings it up, they just bring out their iPad, click it, it goes straight to us. It's integrated in their EMR, it's in our EMR. They receive within 24 hours a click back to have follow up. And honestly, on our worksite clinics, when their employees know, hey, I can get a spot looked at the clinic, guess what happens? They
You
come
don't
in
have
for
to go
their
into the
spot.
clinic.
They go into the clinic, they get their spot checked. Hey, while you're here, let's check your cholesterol and your blood pressure
Mhm.
and a hemoglobin A1C.
So
So
it
it's a
increases
draw.
engagement.
It
Mhm.
increases the engagement and it's a mutual benefit. So we're excited to partner with on-site clinics, and we're very sensitive that it has to be a 2-minute tap out or it's not going to be feasible for them to work it into that on-site work clinic. So that's one of the advantages I have in 30 years of doing this. And in helping coordinate on-site clinics, I understand how important workflow is,
Mhm.
and our team is dedicated to coordinating that 2-minute tap out.
That's right.
So Bob has a question. Bob, what can we help you with?
Yeah, Doc and Elizabeth, when someone has the virtual encounter with the dermatologist and there is a recognition by your team that that spot doesn't look very good and you need to get in and see someone.
Mhm.
Well, from what you said earlier, there's somewhere between a 40 to 60 day lag for them to get in and see someone. So how can you help with that in any way? I mean, do you have a network or do you have a way to help get people in faster and that they don't have to still wait? Great, I got this confirmation. I need to be concerned about this, but I still got to wait 40 to 60 days. How can you shorten that cycle that the patient can get in quicker? Can you?
Well, for the short answer, yes. And how we do it is interesting. We have what we call a preferred referral partner program. And these are colleagues like myself that say, I have approached them to say, hey, if I see a spot and I'm worried about it, can you get them in within a week? They always say, sure. Are you the one looking at it? I said, well, if it's not me, it'll be a board certified derm. They're board certified and they have experience in this? Yes. Okay, yeah, sure. I'll hold a spot for them within a week. And the reason that I get that always yes answer is because that is a high acuity patient that these people have been specialty trained to see. So what we're doing is increasing their specialty clinic scheduling efficiency by bringing them in, these high acuity, high risk patients that will likely stay attached to them for their future skin cancer needs. Now, to say, how do you have that deployed right now? We have preferred referral partners in 36 states and over 300 clinics. And that's growing rapidly. As fast as I can take the meetings is as fast as I grab another preferred referral partner. If there's a client who says, hey, we see on your map you don't have one of these preferred referral partners, we really like Dr. Jones Dermatology, we'll engage them to explain the program. And I haven't had one yet say no when we explain what it is that we're doing. And they'll say, yeah, we'll get him in within a week.
Okay.
And the second part that's very important, and Bob, you didn't mention this, but it is okay, great. You get them in, that you get them an appointment. How do you know that it's been in and how do you know it's been treated? We have a closed care loop portion of our program. If you're going to be a preferred referral partner, you agree to help us close that care loop for that referral as we would on any normal referral, as I have done for 30 years practicing individually as a skin cancer surgeon. Meaning, I want a copy of the note. I want a copy of the pathology report that tells me case closed, this one's been addressed. And that's how we deliver industry leading results that I'm going to show you in a few minutes, I think, because I know we're close on time.
Yeah. Show it. Show us.
Yeah, go ahead.
Show it. Yeah.
Okay, this is where I get really
He
excited.
does.
So this slide it's our 2025 clinical data review. And you could just simply change the title of this to say, Check My Spot Works. And this is why. We reduced time to definitive treatment by 16 months. And Daryl asked a question earlier, what does that mean? Well, that's about a stage and a half progression for melanoma, or at least $150,000 on annual spend for the rest of that person's life while they have that elevated condition, if it were more than stage 2 or 3. We found melanoma in 1 in 74 cases, which highlights that point of discovery, problem focused approach that we have as opposed to general population screening. These are spots that have been changing, and these are spots that have been people have been worried about. So that helps us have these results. The non-melanoma skin cancer is about 1 in 10. And the pre-cancer spots, which are indicative of long-term sun exposure and higher risk, in about 1 in 7. And 100% users would recommend this service to someone else. So the other thing that if you look on the pie chart, what does this mean to my employees that are using it? 3 out of 4 times that spot is going to be okay, and about 1 in 4 are going to come in. And that's not missed care, that's smarter care. And this is an industry leading standard. It's what it should be, because you are keeping unnecessary cases out and at work, and you're getting faster, more rapid treatment that results in better outcomes for that majority that come in. I am so excited about what y'all are looking at right here. And as we continue to collect data,
We're not seeing that slide, by the way.
Oh, you're not?
No.
It says 2025 clinical data review. Okay, you seeing it?
I see it.
Oh, okay.
Okay.
Yeah.
Okay,
Daryl,
good.
do you see it?
I see it fine.
Okay.
Okay, excellent. So, again, in the summary of all of this, this to me is as large of a slam dunk as you could see in a new form of healthcare delivery. Our direct access platform, it's award winning. We've presented this out to large healthcare employers, healthcare purchasers, and they see this. Now that we have these results, the success is in. We're seeing earlier action, better outcomes, and a much lower risk for an employer's health plan population members.
Okay, before we run out of time, I want you to pop back to the how it works slide. Because
Okay.
I don't think we've actually told y'all how it works yet. So do you mind if I do that?
You look like a proud mama, Elizabeth.
So Check My Spot is really simple to use, and I want to tell you about our Easy Lift Pledge in a minute as well. But you just download the app for free on your phone or your tablet. And then you create an account. If you have a dermatologist, you select that. If you don't, we'll find you one. There's a really clear video on how to take an excellent picture because it's critical that the picture is good to read it. So you submit your photos and a brief medical history, a little bit about your skin cancer history, your family history, goes to one of our screeners. In 24 hours, you get your evaluation, and it either says you're fine, keep an eye on it, the picture's stored on your phone. If it changes, take another picture, compare it, or you need to come in. And then that's when the preferred referral partner program comes in. We expedite your referral to specialty care.
Yeah, and like Liv mentioned, our clinic equivalent is the case summary report, which you see on the slide demonstrated now. It's easy to understand. It's a stoplight form. This is downloadable onto the employee's device. It can be forwarded to whomever they would like to see this report. If we refer them in, this is what the preferred referral dermatologist will receive. So there's no question about which spot was in question. And it also is individualized and has customized instructions to help guide that patient individually in any event, whether this spot is a benign spot or whether it's something that requires greater attention.
Before we move on to wrap up and summarize, Elizabeth, you said something that was really important. It's a free app that you can download, but how is it paid for? Can individuals go in and download this app and then it's per participant? Can employers partner with CheckMySpot and push out the app? What is the payment methodology?
Absolutely. CheckMySpot is available to everyone in the states where we're active. And like individuals can download it on their phone and use it. And it is currently how much per submission for an individual that's
Yeah,
not attached?
so direct to consumer is a $79 per use fee, which if you consider the delta on an average derm visit, you can see the savings on that, particularly if you're the 3 out of 4 that come in, or if you're the 1 out of 4 and you receive earlier treatment. But for employers who want to provide this as a benefit to their employee population, we do run a PEPM with a per use fee, and that PEPM covers our onboarding, our eligibility, so that as an employee uses it, they won't experience the payment window where they say you pull out your credit card, et cetera. It'll say your business has covered this, and you have X number of uses per month as has been determined by that employer. And then it's a per use fee after that. So we're
Lower one though.
but lower. It's a $59 per use fee for employers who have engaged with that PEPM. So we're excited about how that can offer an ROI. We're validated by the Validation Institute. It's important for employers to realize that the most common cancer will produce a linear return of 7+% reduction in annual claims payouts for skin cancer. And that offers at least a 3 to 9 times ROI. If you happen to be one of your employees happens to be the 1 in 74, where we found all melanomas at stage 0 or 1, you have mitigated a catastrophic claim, and that is anywhere from $50,000 to $500,000 plus, depending on how long that patient says it would have taken them to get in. So
Plus we could have saved life saving as well.
Well, absolutely. But and it keeps that employee productive at home. I mean, productive at work and happy at home.
I was going to say a couple of the key takeaways that we discussed was, and this one stands out, every month between discovery and definitive treatment matters. If you can't get, it took me 3 months to get into a dermatologist. If I had, a skin cancer, if I had a lesion, I would have been freaking out, right? Yeah. I mean, you worry about it and you can't sleep. It affects your whole life. And it affects your work. Early discovery changes the entire claims trajectory. So not only the quality of life, but every month that you're waiting, every week that you're waiting, almost every day that you're waiting, not only affects your quality of life, your diagnosis, but also the cost associated with claims. So those are some key points to keep in mind.
Exactly. And I want to mention that we designed CheckMySpot to be super easy to use because employees aren't going to use a benefit if it's complicated. We have an easy lift pledge that says we'll give excellent onboarding materials, continuing education materials. We have methods of engagement with the employees where we drip on them to keep, CheckMySpot top of mind so the benefit will be used because we all know that it really doesn't matter if everyone signs up for it. If they don't use it, it's not helping anybody. And so we really have to work with engagement and keep leaning on employees and keeping their interest up so they realize what a great thing they have in their back pocket.
Yeah, I want the HR director, I want CheckMySpot, and I want the employee to have a high five party. When they catch these things early, or they make it easy and simple. With the slide up there, if anyone's interested, if they'll hit that QR code, they'll go to our website. You'll see a patient journey that will explain in real life, real patient testimonies, employee testimonies. Please reach out to us. We'd love to continue a conversation, tell you exactly how it works.
And if you have any questions after the webinar, just email us. We'll be happy to answer them.
We have a question from BGB squared.
Okay,
Okay.
that might be Bob. No?
No, it's not. I think you're unmuted.
Okay, can you hear me?
Yes,
Yeah.
yes, sir.
Hey, there you are. So I guess I'm the mini me for Bald Guy Bob. That's like the biggest compliment I've gotten in months. So I'm running with that one. And this was a deeper dive for me, Dr. Elizabeth. I got to meet you very briefly at Ascend a few weeks ago in Nashville. So
Oh, great.
I was so intrigued by what you shared on stage. I wanted to learn a little bit more. My question for y'all was twofold. One is I kind of geeked out, Dr. Mike, after you said the whole slip. So I found out on the internet, slip, slop, slap, and then they even have rap on there as an add-on.
Right.
What
Part of
was
that
the last
campaign.
one?
So
Wrap.
Wow.
Yeah.
good luck
Yeah.
fitting that on a Hallmark card. But my second question is a guy who works with benefits producers all across the nation for our industry. Can your product and solution be bolted onto a fully insured plan for an employer, or does it have to be on a self-funded chassis?
That's it is preferable that it is on a self-funded, but let's break that apart and see what working solutions that we can have maybe in a follow-up discussion. If I know that's not a satisfying answer, but it's rather complicated for me to explain in the few minutes we have left.
Right, because right now we're a non-insurance solution. So we're trying to operate outside of insurance, but there's always a way to attach it on the side or figure a way to integrate it into your system.
Understood. Thank you all. Appreciate the information. It was
Good to
great.
hear from you again.
Yeah, and I think Bald Guy Bob,
Yeah,
that's ironic.
the real one. I'm gonna hunt down
the
that.
real
I'm gonna
one.
hunt down that mini me.
That's right.
That's
You
stealing my
keep
brand. But again, if a fully insured employer wanted to, they can still promote your direct to consumer program,
Correct.
right?
Absolutely,
Again,
yes.
I mean, they
Yeah.
could still promote it to their employees that hey, we think this is a great program. It doesn't quite fit maybe in the fully insured world, but this is this impacts everybody. I'm making an assumption about everybody that's alive in the United States knows somebody who
Absolutely.
had a visit and maybe a bad result, but at least they knew someone or themselves went in about something that was concerning them. So to help the greater good, not just self-funded employers, they can still promote it.
Right.
Absolutely. And I
Okay.
honestly, Bob, I think at the trend we are working diligently to make this a claims-based solution. Also, the issue that we have on insurance has to do with telehealth regulatory requirements for downstream care. It's complicated. I'm happy to discuss it in full detail. I think in the near future that we will see it can be equally applied to each of those self-funded employer programs as well as a fully funded.
So as we wrap up, thank you all for joining. And Mike and Elizabeth, thank you so much for this presentation. Just chock full of a lot of great information. I can't wait to get this webinar put together and get the vignettes put out so we can get the word out. I was like Daryl, I couldn't wait for this webinar because this is such tremendous work. And Elizabeth, if you came up with this idea, you are genius.
Oh,
She really is genius.
He gives me more credit than I deserve.
No.
But
She's
we
really
make a good team.
She's really genius. I'm just ready for the high five parties to begin with everybody who's had a benefit with
Just
it.
show Mike a pie chart with some numbers and give him a high five.
Can you use the hand for CheckMySpot with the little check mark? I love
We
it.
do.
So you can just hand five your
Absolutely. Yeah. It is. It's the helping hand and the high five hand, both. Yes.
I love it. I love it. So let me leave everyone with this thought. This is a recorded webinar. We will be breaking it up into small little bite-sized vignettes, and we will be posting it. Bob will have a YouTube site as well as we'll post them on LinkedIn. If you're interested in getting this recording, don't hesitate to reach out to me, k@augmento.health, or give me a call. And next week, this is the second out of our series of 8. Next week, we have Archer Health. It kind of fits right in with this, right? On-site employer clinics designed for small to medium-sized groups. That'll be at 11 a.m. Eastern Time. Archer Health is different, guys. Let me tell you. They can take a room and reconfigure one room, and you can see patients 1 day a week or 5 days a week.
Wow.
I'm in the on-site employer venue for the last 25 years. Nobody else does that. I mean, they don't want to touch people under, a certain amount most of the time. So that will be a webinar that you don't want to miss, really. You can sign up. You already signed up for this one, so you can already hitchhike onto that one. But feel free to reach out to me if I can be of any assistance. And thank you again for joining. On a bright, sunny day, we learned about skin cancer awareness and prevention and how we can save not only quality of life, but many, many dollars and our loved ones, right?
Right.
So thank you all for joining. It's been our pleasure.
Thank you for having us. And thank you for all the thoughtful questions. I hope you'll have a great day.
Thank you. Bye now.
Bye.